Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may experience a wide range of symptoms, including hallucinations, delusions, disordered thinking, and impaired emotional expression. These symptoms can make it difficult for individuals with schizophrenia to function in their everyday lives, and can lead to significant emotional distress and impairment in social, occupational, and other areas of life. Symptoms of schizophrenia typically appear in late adolescence or early adulthood, and the disorder is usually diagnosed in the late teens or early 20s. However, some people may have their first symptoms in childhood or later in life. The onset of symptoms can be gradual or sudden, and the severity of symptoms can vary greatly from person to person. The exact cause of schizophrenia is not known, but research suggests that a combination of genetic, environmental, and neurobiological factors may play a role. Studies have found that people with schizophrenia have structural and functional differences in certain areas of their brain, including the prefrontal cortex, hippocampus, and temporal lobes. These differences may impact how the brain processes information and how a person experiences reality. There are several different types of schizophrenia, including paranoid, disorganized, catatonic, and undifferentiated. The type of schizophrenia a person has can affect the type and severity of symptoms they experience. For example, people with paranoid schizophrenia may experience intense and persistent delusions of persecution or grandeur, while people with disorganized schizophrenia may have difficulty speaking or communicating and may display disorganized behavior. Treatment for schizophrenia typically involves a combination of medication and therapy. Antipsychotic medications, such as risperidone, olanzapine, and quetiapine, can help reduce symptoms of psychosis, such as hallucinations and delusions. These medications can also help improve cognitive symptoms such as memory problems, attention difficulties, and difficulty processing information. Cognitive behavioral therapy, CBT, and other forms of therapy can also be very beneficial for people with schizophrenia. These therapies can help individuals manage their symptoms, improve their social and occupational functioning, and reduce the risk of relapse. Family therapy can also be helpful in supporting the individual and family members in coping with the disorder. It's important to note that people with schizophrenia can lead fulfilling lives with the right treatment and support. Early diagnosis and treatment can improve the chances of recovery, and many people with schizophrenia are able to live independently and maintain relationships with family and friends. Supportive services such as case management, vocational rehabilitation, and housing can also be beneficial in helping people with schizophrenia to live as independently as possible. In conclusion, schizophrenia is a serious mental disorder that affects how a person thinks, feels, and behaves. The exact cause is not known, but research suggests that a combination of genetic, environmental, and neurobiological factors may play a role. Symptoms can vary greatly from person to person, and the type of schizophrenia a person has can affect the type and severity of symptoms they experience. Treatment typically involves a combination of medication and therapy, and early diagnosis and treatment can improve the chances of recovery, and many people with schizophrenia are able to lead fulfilling lives with the right treatment and support. It's important to be aware of the disorder and understand the available treatment options in order to provide the best possible support to those who are affected by schizophrenia.